Thank you, Shreya. Noelle, we're going to ask that you speak about your Oregon Association.
Thank you very much. I just want to make sure I have the clicker to change the, is it this one?
Yes.
Yes, okay, great.
It goes forward.
All right, excellent. So good morning, everyone. My name is Noelle Wiggins, and my colleague Adriano Rodriguez Palacios and I would like to really thank the conference organizers for inviting us and bringing us across the country from Oregon to speak to you today. Today I'm going to share a really brief introduction to the Oregon Community Health Workers Association, which we fondly refer to as ORCHWA. It's an organization that I helped to found and about which I feel quite passionate. During this brief presentation, I'm going to be sharing a bit about ORCHWA's origins, how the organization is funded, how we interact with Oregon's coordinated care organizations, and I'll say a bit more about that in a moment. I'll be talking about ORCHWA's work in training and workforce development with community health workers, and also a bit about our work conducting research and evaluation with and about community health workers. So as Shreya has already mentioned, definitions are important in this field, as in most fields, so that you will know what I'm talking about when I talk about community health workers. I'm going to share ORCHWA's definition, and it is that community health workers are trusted community members who participate in capacitation or empowering training so that they can promote health in their own communities. And we always hasten to add that communities can be defined by race, ethnicity, geography, age, sexual orientation, disability status, other factors, or a combination of factors. We also support the longer definition of a community health worker created by the American Public Health Association, in which we've been involved since the early 1990s. I wanted to add, and this will again echo some of what Shreya said, that our definition of a community health worker is really complemented by our understanding of community health worker and promotora history. According to that understanding, this model grew out of natural helping and healing mechanisms that have existed in all communities really since the beginning of human history. Those models became formalized in areas where people were being systematically denied health and health care and the conditions necessary for good health. Thus, from its inception, the community health worker model has been dedicated to increasing health equity, and I think that is especially important to remember in the context of healthcare reform. So now I'll share a little bit about how ORCHWA came into being. We are proud in Oregon of our long history of successful community health worker promotora programs, which include the Community Health Representative Program, founded at the Confederated Tribes of the Umatilla Indian Reservation in 1967. Outreach worker programs started at many county health departments in the midst of the HIV/AIDS crisis in the 1980s, and also the El Niño Sano, or the Healthy Child Program, which was started in 1988 at La Clínica del Cariño in Hood River, Oregon. My first job with promotores in the United States was as the program director at El Niño Sano, and a grandchild of that program still exists today. In 1994, promotores from El Niño Sano helped to organize the first statewide community health worker promotora organization under the auspices of the Oregon Public Health Association. It functioned for 10 years. And then in 2011, in the midst of healthcare reform in Oregon, community health workers and allies really became aware that a lot of policy was being created about community health workers. And although individual community health workers were involved, community health workers did not have an organized voice, an organized and unified voice to speak on their behalf in the healthcare reform discussions. So with some funding from the Northwest Regional Primary Care Association, we organized 2 leadership development workshops in 2 regions of the state. Those served as the jumping off point for ORCHWA, which held its first meeting in November 2011 at the Asian Family Center in Portland. Initially, ORCHWA didn't have any funding. Rather, it was supported by in-kind donations from the Oregon Latino Health Coalition and the Community Capacitation Center at the Multnomah County Health Department. After receiving a few moderate and small grants, in 2017, as the result of more than a year of work, ORCHWA received a 2-year, $3 million investment from HealthShare of Oregon. HealthShare is Oregon's largest CCO. And currently, ORCHWA has over 13 funding sources, including grants, contracts, and fee-for-service, and an annual budget of more than $3 million, which, for those of you who know community health worker associations, that's a large budget for a community health worker association. Before talking about how ORCHWA works with CCOs, I'll just mention that loosely translated, a coordinated care organization is Oregon's version of an accountable care organization. More fully translated, it's a group of health systems and provider groups that agree to work together and apply to the state to be funded to serve Medicaid beneficiaries in a given region of the state. The purpose of the HealthShare investment in ORCHWA was to support ORCHWA to build its infrastructure so it could serve as a broker between health systems that want to obtain the services of community health workers, promotores, promotoras, and community-based organizations that already employ those community health workers. We believe that there are several benefits to this arrangement. First, we believe that existing community health workers and community health worker programs deserve to be supported by healthcare reform dollars. We believe that community health workers in culturally specific organizations often will be especially well supported to maintain cultural worldviews and cultural approaches to health, although they often can also work well with community health workers employed by health systems. We believe that community health workers in community-based organizations may often be better able to play a full range of roles, including roles as organizers and advocates. And finally, we hope that this scheme can increase salaries for community health workers in community-based organizations. When this scheme is fully developed, ORCHWA is going to be able to provide certification training for community health workers, training for community health worker supervisors, which I agree with Shreya. It's not just about training community health workers, it's about training all the people that they work with. We'll have an online case management platform, and we'll have research and evaluation services. Currently, we're developing contracts with Kaiser Permanente, and we're pursuing contracts with other health systems. So now, very quickly, I'll share a little bit about training and workforce development at ORCHWA. Assessment of training needs at ORCHWA happens both formally and informally. ORCHWA convenes 3 collaboratives, which include community health workers, their supervisors, and funders. So this puts us in daily contact with community health workers in the field, and this is in addition to the fact that most of the staff at ORCHWA are community health workers. Formally, we assess training needs by conducting regional and statewide needs assessment, and I have a few copies of the summary report from our most recent needs assessment. It's also available online. The next part is really crucial. The methodology and the philosophy that we use for community health worker training, and in fact all of our work at ORCHWA, is popular or people's education. And to be true to this philosophy, I have to ask you, when you hear community or when you hear popular or people's education, what comes to your mind? Freire. Okay, what else comes to your mind? Quick, I have like 30 seconds here, folks. You got to help me. Uplifting. What else? Organizing. Great. What else? What? Accessible. Great. One more word. Participatory. Thank you so much. Okay, so that was an example. So popular education is a philosophy and methodology which is most closely associated with Paulo Freire, a Brazilian educator and political theorist. And it's based on the idea that people most affected by inequities are the experts about their own experience. I've got to stop there and move on to my next slide. Further, ORCHWA and its CBO partners provide both cross-cultural training and training that's culturally specific. We provide both initial training and ongoing training, and I'm going to get to these last couple of slides because they're so important to me. In addition to doing training, ORCHWA is also committed to conducting research and evaluation with and about community health workers. As Shreya mentioned, ORCHWA is committed to contributing to the body of academically credible research and evaluation because that has too often not happened in this field. We're also committed to doing research and evaluation in partnership with community health workers, using a community-based participatory research and evaluation framework. And here's the next connection to the morning session. And building the skills of community health workers as researchers and creating the next generation of community health worker researchers and evaluators by supporting community health workers to obtain more formal education when they so desire. This is an essential part of community health worker workforce development. Oregon community health workers and their allies have authored multiple peer-reviewed publications, and I'd be happy to provide a list to those who are interested. We also lead the National Community Health Worker Common Indicators Project. Thank you.
Thank you.